Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Farzana and I am an occupational therapist based in Johannesburg, South Africa. I have alhamdulillah just completed the training through Hijama Nation on Hijama therapy, and I am quite excited to embark inshallah on a new adventure into my career. With regards to the case studies, I was alhamdulillah quite fortunate to have a varied number of patients. Their ages ranged between 23 and 62, and I also got an opportunity to see different types of conditions. So I was treating patients who had complaints of chronic sinusitis, neck and shoulder pain, lower back pain, knee pain, female menstruation problems, stress and related conditions, abdominal bloating and poor sleeping patterns, and urinary and bladder problems. So alhamdulillah, it was a wide variety of things that I was treating, and it was a good opportunity and a good learning curve for me. I think first and foremost what I learned was that it's quite important to take a good history from the patient to get as much information with regards to their health as possible, but also with regards to their lifestyle and other factors that might be impacting on them, such as their stresses at home, at work, their diet, their eating patterns, sleeping patterns, etc., so that you are able to present a holistic form of treatment in addition to the Hijama therapy in order to bring your patients to a more balanced way of living. It also increased my own awareness of my own health and the way that I take care of myself, and the areas that I neglect myself in, and that has been, I think, a good opportunity for me just to be more cognizant of that. With regards to how my patients felt about their first session, most people actually felt excited and curious, one or two were a little bit apprehensive, just because they had unsuccessfully been treated via Western medicine before. They had they had recurrence of their symptoms, so they were feeling a little bit, curious as to whether Hijama is actually going to help them or not. But I think overall, alhamdulillah, after the 6 sessions, most of my patients found a positive response and an improved health, alleviation of their symptoms. So that was very positive and encouraging to see. Their final view at the end of the 6th session was that it's definitely something that helped them to relax, that gave them alleviation of their symptoms, even though there might have been some exacerbation of symptoms before there was alleviation of symptoms. So overall, I think the response was positive, with a lot of my patients feeling that it's definitely something that they would recommend to family and friends. We have in fact had a lot of interest from outside people, from the family and friends and community and members of the public. So it's quite an exciting time. I'm also quite excited because there aren't very many Hijama therapists in South Africa at all, and in particular female therapists. The therapists that are around are male therapists, so being a female therapist and being able to be accessible to other females is actually something which there's a big need for, and which I'm quite excited about. I think with regards to my feedback on my skills and my methods of treatment, one of my patients summed it up quite nicely the other day when she said she can actually feel the difference in my hand with regards to the massage therapy. Initially, I was still getting used to the technique and of the movement being fluid and applying the right pressure and the correct technique. So alhamdulillah, I'm feeling a lot more positive, I'm feeling a lot more confident, and my patients are feeling a lot more at ease when they come to me as well, and that's quite nice. I must admit, I was quite nervous before my first wet cupping session, and but alhamdulillah, things worked out well. I think I was put at ease when my patient actually said, you know, that it was just a slight discomfort that they felt initially, but after that they were fine. People were receiving it very positively, and for me that was, you know, gave me the strength and the confidence to actually continue. It's very important, I think, to make sure that, you know, you have a proper clean working area which is hygienic, that your equipment is sterilized and clean, so that your patients feel at ease, that they feel that they, you know, are coming to a place which is reputable and that is actually, you know, holding a good health standard. That's very important and something that you should always keep, you know, keep in mind. With regards to the you know, note keeping and records, very important. I realized it's very important, I mean, in any medical situation, to keep proper notes and records in any case. But with regards to hijama, I think because the responses from the patients are so varied, you know, some patients felt energetic after their sessions. Some felt very tired and lethargic and wanted to sleep. I had a patient who said she cried almost for a whole day for no apparent reason. And for me, I made it a point of keeping in touch with my patients just to make sure, you know, I understand how they're feeling, and I make a record of it, and then see how that changes over the weeks as their bodies sort of come more into alignment. Then the side effects are less, and they just overall start feeling better. But because everybody reacts differently, I think it is important to keep proper notes and records. It's also important to keep a note of, for example, how much pressure you're using on the suction pump, so you can grade your treatments accordingly, to keep a record of which areas you've been working on, and you know, keep a record of that. It's also good for to show the patient their improvement over time. So yes, notes and records are very important. So I think I benefited from the hijama training on this course, definitely. I really feel privileged, alhamdulillah, to now be skilled and equipped with a skill which is a sunnah. So for me, I think that's like a double benefit, because you are benefiting your patients, but not just from a health perspective, you're also promoting and practicing a sunnah, which in itself is beautiful. Yes, I felt really great. I was, you know, when my patients gave me positive feedback regarding their health, regarding my technique, I felt really great, and I'm thankful to Hijama Nation for their training and their support. It's an excellent course. I think the fact that it's online, it was quite comprehensive, and I think it's really laid out quite nicely. How do I see my future as a hijama practitioner? Well, inshallah, going from strength to strength. Like I said, there's quite a lot of excitement around it, so I think the next step for me will be to put together some promotional material, some, you know, posters and flyers and pamphlets, informational and promotional you know, media, which can then be used as, you know, brochures to give to potential patients, as an information brochure, perhaps setting up a website. Yeah, so I'm looking forward to growing and to reviving this beautiful sunnah. Jazakallah for the opportunity. Assalamu alaikum wa rahmatullahi wa barakatuh.